Hey everyone, in this video we're going to cover the bony landmarks, really, of the thorax. Um, and hopefully you'll have a better understanding of these muscles right here, sitting between the ribs. Um, but let's go ahead and dive in and get started. So, just so we can get rid of them, let's start with the muscles. As you can see, you have muscles that sit in between the ribs, if you did not know that already. And there's two sets. You have the external intercostals, and then you have internal intercostal muscles. So as you're looking at a cadaver or looking on here, you can see that the muscle fibers, that they're running more of like on an angle from the rib towards uh, like the xiphoid process or towards the medial part of the body or to the pelvis. Okay, like whatever helps you to remember. I like to think of it as I put my fingers together in my hand, and if I can put my hand into my pocket, that means that that is going to be external intercostal. If we get rid of this and the muscle fibers are like this, and I put my fingers together and I put them the same way as the fibers, and if I can't put them in my pocket, it means that they are internal intercostal muscles. Okay, if we get rid of that, now we're left with our ribs and our vertebrae and the sternum. Okay, uh, starting from the top, we have our superior thoracic aperture, if you want to call it, if that's what you've heard it as before. Um, Down below, looking at it like this opening down here is going to be your inferior thoracic aperture. Okay. And coming back up to the sternum, this is going to be your jugular notch. Um, it's also known as like your suprasternal notch. Uh, we need to remember that when it comes to the vertebrae, it comes in breakfast, lunch, and dinner, right? So our cervical vertebrae, we have 7 of them up here. And then our thoracic, we have 12. And so we have ribs for each and every one of our thoracic vertebrae. And then below the thoracic is our lumbar, which is our really our uh, weight-bearing vertebrae. That's what they're really used for. So let's pull this out and just look at the sternum for a sec. So here it is. Oh, that's not what I wanted. I wanted to do this right here. So our sternum has 3 parts to it. We have our manubrium, we have the body of the sternum, and then we have our xiphoid process. Okay. Uh, there's going to be specific parts of uh, each piece. So if looking at this from the posterior side, from the anterior side, this is going to be your clavicular notch. Here's going to be your jugular notch, or that suprasternal notch. This blue sitting right here, that is going to be your sternal angle. So as you can kind of see, it makes an angle right there. This is where your second intercostal vertebrae, or second costal cartilage from your second vertebrae or rib connects into. Sorry. Then we have the body of the sternum right there. And then we've got that xiphoid process at the bottom. So let's get rid of the muscles. So now we know we have 12 ribs because we have 12 thoracic vertebrae. So breaking down those ribs, 7 of them are going to be what's called true ribs or vertebrosternal ribs, or what these are called. And you have costal cartilage is what connects the rib into the sternum. But we have 7. The first 7 are called vertebrosternal ribs because they go straight from the vertebrae to the costal cartilage that connects into the sternum. Okay. After the first 7, so here's the 6th, here's the 7th, that cartilage comes straight right there. The next 3 are going to be vertebrochondral ribs. And you can see right here, this vertebrae, number 8, 9, and 10, they connect into cartilage, but their cartilage all connects into one piece before it comes into the sternum. Does that make sense? And then you have your false ribs, or floating ribs, sorry. The last 2 are floating ribs, 11 and 12. 8, 9, and 10 are going to be false ribs, is another name for them. And then you've got your floating ribs right there. So, I guess just checking back on my notes of things I wanted to share. Your xiphoid process is definitely a piece that can be broken during chest compressions of CPR. The internal intercostal muscles, they're used when you're breathing out. So you're deflating your lungs. It's used in expiration. As for your external intercostals, they elevate the ribs and they're active during inspiration, so when you're inhaling. The other thing that I really want to share with you from this one is your oscillation areas. So like areas that your doctor is going to listen to certain parts of your heart, especially the valves. So you're going to have, let's see, it is going to be where your second rib is. So right in here, doctor's going to listen to this area right here to listen to your aortic semilunar valve, so on the right side. And then this is going to be your pulmonary semilunar valves, is right here. As for your bicuspid and tricuspid, your tricuspid is going to be in here, in this area, and for your bicuspid, it's going to be right here, in between your 6th and 7th rib. So you can remember that by all positions take money, if that helps. But this is again where the doctor puts their stethoscope to listen to those valves working in your heart. And I think that's really it for this video. I'm really not going to cover your mediasternal or midclavicular or your axillary lines, just more landmarks. In this video, I feel like they are just fine in the textbook video. But if you have any questions, leave them in the comments. And if the video helped, just hit the like button, and we'll see you in the next video. All right, I just want to give credit where credit is due. These are the books and the resources I used for the videos. So first we have Essentials of Human Anatomy by Dr. Kurt Walker. We then have Essential Clinical Anatomy by Keith L. Moore and M.R. Auger and Arthur F. Daly. I also used Structure and Function of the Human Body by Mark Nielsen and Jamie Garbett. The last book I have is The Concise Book of Trigger Points by Simon Neil Asher. And then I used the app called Complete Anatomy. As you've seen from the videos, it's amazing. If you can afford it, I suggest it. It's such a useful tool when learning this stuff. So that's it. Have a good day.